thing.
There's gotta be something
Another
really different
change
here
order.
because
Do
we
you
never
have
have
anything about
updated.
that?
Yeah.
I'm wondering
But
why all
anyway,
these
it's cleaned
change
up and
orders.
good.
It's not that they're that uncommon, but I'll read through it again. I just glanced at it to see what was there, but I'll look at that again and see.
But
Maybe
yeah,
it's
I
in
read through it
here.
and I'm thinking, you mean to tell me we didn't have that in the original plan?
Yeah. That's
That's
unfortunate, but that's,
concerning.
yeah, that, it is. And really, that comes down to how well did you
Right.
plan and vet this whole thing out, and
And that was before we ever got involved, so
Yep.
that's what, and I don't know, what do I? But I did just read through that thinking, okay, I don't know exactly what this stuff is. but
Here, here.
A
So that was a
duress
question I was
alarm,
going to
and
be
it was
raising,
false.
but.
Oh,
There's an email.
Okay.
Just
Alright.
now I saw.
Okay. I was like, this is different.
I don't think I've heard an alarm.
Yeah, it was, what was interesting was there were lights that went off, but you could not
Is
hear
this
anything.
stuff for
the
us, or is
commissioners
this
were
something?
saying.
I don't know, what's
The
that?
door not been open, you wouldn't.
You're the only one that got it evidently.
Well, it's not mine, then.
Very interesting.
You got to put the anti-fogging stuff on my glasses. Luckily, the mask is pretty tight.
Are we ready? Are we on? Okay. My computer says 8:30.
Same.
computers will lie to you.
8:29 there. Like, one of these days we'll get that fixed.
Well, I guess as long as we're recording. All right, good morning, everyone. I'm going to call the Public Health and Human Services Board to order. First item on our agenda this morning is the approval of the consent agenda. I am going to suggest we move item D, the temporary employment agreement, down to the first item in the items for action, board action. If everybody's okay with that?
Yeah, I'll make a motion to approve the consent agenda as amended.
Thank you.
I'll second that
Could
motion.
I'm sorry, could I ask a question real quickly?
Yes.
I'm sorry I'm late. My clock was off. What is the amendment to the agenda?
Oh, the temporary employment agreement, just to move it down to after we hear from Grace and for items of board
Okay.
action.
Do you all realize we do have a policy that temporary hires are not subject to board approval?
Oh.
So it didn't even need to be on our agenda, is what you're saying. Should we remove it from the agenda?
That would be an option.
I guess that would be up for discussion now that we have a motion on the floor.
Okay. Well, I was not aware of that, so that, I appreciate that. And I'll amend my motion. Well, I'll withdraw it. Yeah, thank you. I was looking for the word. I was gonna say something more brutal, which didn't need it.
I would also note that the policy does require staff to notify the board
Okay.
of temporary hires, but there's no requirement that the board approve it.
Actually, the policy, I believe, says may. It's not will, but I read it and I thought it said may go before the board. or the-
Oh, okay.
I can double check that language, but I do know that board approval is not required.
According to the employee handbook, yeah.
Right, which is our policy.
So let's start over. Are you withdrawing your motion? Commissioner Mills?
I'll withdraw it, and then I'll, make a motion to approve the consent agenda.
Is that acceptable to you, Commissioner Sullivan?
Yes.
All right, we have a motion on the floor. Is there any discussion?
It might be worth, if there's any question about that, it's probably worth clearing up. So I'm,
Yes,
can,
I'm a patient man and willing to look that up for our discussion here, but I'm assuming the suggestion was just to discuss it more? Is that, or what?
well, I just have a problem with voting on something that I don't really know the details of, which is why I wanted to move it until after we had an opportunity for Grace to tell us more, and I think that's just good policy for the public and transparency that we know what we are voting on.
Yeah, yep, no, that makes sense. And I'm comfortable if our policy is not to need board action for temporary employees. And I'm also comfortable taking action on it later, so either way is fine by me, and I guess we'll just look up the policy and get
Yeah.
clarity there.
So the language is a formal recruitment and selection process is optional for filling of temporary positions. The board should be notified of all temporary placements. The administrator's office will work with the department head to discuss how the temporary position should be filled. So notification is a should, not a shall, but there's no requirement that the board approve a temporary hire.
Okay, thank you. I don't have any further discussion, Madam Chair.
Any other further discussion from any other commissioners? So we have, your motion was withdrawn, your original motion was withdrawn, or amended, I'm sorry, amended to just approve the consent agenda as presented, is that correct?
Well, yeah, the long and short of it is yes.
Okay. And if there's no further discussion, I'll call the vote. All those in favor?
Aye.
Opposed? Aye. All right, we will move on then to Grace. Thank you for being here.
All right, thank you for having me back. So I'll start with the situation update and then go a bit more in depth into what we've been doing in the public health team over the past month. So our current case count is at 303. So we've gone up 52 cases since our last PHHS board meeting on October 19th. We continue to see a relatively high proportion of these cases in youth. So 20 of these 52 cases, or 30% of the month's total case count, have been in youth 18 and younger. We continue to work very closely with schools and other youth-serving agencies to reach out to people who've been directly exposed to COVID-19 through our contact tracing process to be able to provide appropriate public health recommendations to those individuals in terms of quarantine and testing. We are still seeing a significant number of cases of COVID-19 in people who are fully vaccinated. These are called breakthrough cases, and this mirrors trends at the state level. And I'll link in my notes to a state resource on the breakthrough cases because the Minnesota Department of Health has updated this resource in the past week, and it provides some excellent visuals and information on kind of how to understand breakthrough trends. It's a bit more challenging for me to pull that out of our past month, but I would say it's probably holding steady at what we saw the previous month, with about a third of the cases being in people who are fully vaccinated. So a few things to note about the breakthrough cases. It's a complicated picture to understand, but a few pieces that I highlight as important. Even as we see these cases, we do not see a rise in severe disease, hospitalization, and death in people who are fully vaccinated. So in MDH's data from September, they show people 65 and up who was the age group most at risk from complications due to COVID. That age group, people who are not fully vaccinated, are 17 times more likely to be hospitalized and 19 times more likely to die from COVID-19 than those who are fully vaccinated. So this is important because right now, in particular, our healthcare systems, our hospital systems particularly, in the region and in the state are stressed. So part of the goal of the response at this point in the pandemic is to lessen the stress on our hospital system so that it's able to continue to care for people who need care, whether it's related to COVID or other conditions. So in other words, we do see some decline in protection against infection, against getting sick. However, the protection against severe outcomes, including hospitalization and death, remains very high. That does not appear to be declining over time. So we do see that decline after about 6 months occurring in people who are fully vaccinated, which is the reason for the rollout of the booster vaccines, and the reason that that rollout is targeted to 65 and older, as well as people who are at a higher risk because of their living or working conditions. So that's a big part of this whole booster rollout, is to bring that protection against infection back to its previous levels, and to continue to provide that additional layer of protection to the people in the community that are most at risk. It's also important to remember that people who are fully vaccinated of all ages remain much less likely to be infected than people who are not fully vaccinated, and that in a time and place where we see large amounts of a disease spreading through the population, we expect to see more of these breakthrough cases simply because people are exposed to more of the virus on a routine basis moving throughout the community. And we do live in that area right now. We do have high spread in Cook County, in the Northeast, and throughout the state of Minnesota. So at some level, because there's just more virus spreading, it's more likely people will come into contact with it, and it's more likely that people in general will become infected with COVID-19. So I think when we talk about vaccination, one of the things that's important to keep in mind is it's both an individual and a population level intervention. So on the individual level, it provides health benefits. It keeps people from having those severe outcomes, from landing in the hospital, and it reduces the chance of passing away from COVID-19. On a population level, when we look at vaccine coverage in a population, the higher the percentage of people who are vaccinated, the less likely those individuals are to be infected, which slows down the spread of the virus and reduces the amount of virus spreading. So we look at things on two levels. We try to encourage individuals to be able to access vaccination, and on a population level, we try to increase the coverage of vaccination in the population to slow down the spread of the disease. So that's kind of a lot of information, but I feel like it's important to contextualize what's going on here. I do have more of an update as to what we're doing in public health, but at the end, I'm very happy to take questions because, as I said, it's a lot of information. So, contact tracing. We've been able to continue to do this work, and it's thanks in large part to the commitment of the staff working on this, both in PHHS and in Grand Portage Health Services, the cooperation of community members to be willing to talk with us, to be able to listen to what those recommendations are and be willing to seek testing if it's appropriate. And it's also thanks in large part to our partnerships with schools, with workplaces, and with other community organizations where there has been spread or there has been the impact of exposure. So I'm very pleased to say that we've been able to keep that up. Testing. So this will get a bit back to the temporary employment agreement and what that position would do. So right now in the community, we have, I consider, excellent access to testing for people who are symptomatic, they have some symptom of COVID-19 and should seek testing because of that, and for people who've been directly exposed and are identified through the contact tracing process. One of the gaps we have in the community is what we call routine testing. So sometimes it's also called surveillance testing. So this is essentially testing on a weekly basis for people who it can be for workplaces, but it can also be for schools. And it is the CDC recommendation that people in schools have access to routine testing. And with the increase in youth cases, I think it's really important to try to work to support our schools to provide better access to this type of testing for kids and teachers who are in schools, because there is a much higher exposure risk given the amount of viral spread we see in youth right now. So this proposal is part of a collaboration with ISD 166, which we're still working out the details of. But the goal is to be able to provide that increased access to routine testing for children and employees in schools and childcare facilities. So the proposal that was part of the consent agenda is to bring back our former temporary public health staff, Andrea Tofty, to be able to assist with developing a pilot program where we're able to collect test specimens and process those and interface with the state's disease reporting system and the contact tracing team. I think Andrea is an excellent candidate for the position given her history working with the team. She's very familiar with COVID-19, the public health response, and our local contact tracing efforts. I think this program or this service will be especially important to our older youth that are in middle and high school, because unlike the elementary grades, they're not as closely podded. Elementary school students are in a classroom with their peers and they kind of stay in that classroom with their peers, but in middle and high school, they're moving through different classes throughout the day. They're playing sports. They have a lot more exposure with one another, and it makes the contact tracing process much more challenging. So being able to offer this both on a routine basis, and if there's ever a situation where we have a large volume of contacts through the schools, it'll also be a backup system for contact testing. So if I do a rough estimate of, I think the highest priority group for me would be middle school, high school, and teachers and staff serving that age group, but it would be open to other families in the community as well. But if I just focus on middle, high school, and teachers serving that group, I estimate it would be a target population of around 300 people. And again, this would be a system or a pilot service that would be opt-in. So it would be something that we'd have to provide education and outreach to families. Why are we offering this? Why are we working with the schools in this way? And really, it's been an unmet need since the beginning of the school year, and the resident district has been very interested in working with us to try to provide this service to families. So I think, and underlying that, I think the reason is that it really does have the potential to significantly slow down the spread of COVID in youth in the community. So that's a bit about testing. I'm going to move over to vaccination, which is exciting. This has been a very exciting part of the past month. So we did kick off our pediatric COVID-19 vaccination events last Friday. We vaccinated 65 to 11-year-olds at the community center, which represents 20% of this age group. And we have 2 additional pediatric vaccination events this week and next week. This was a huge community effort, thanks to our partnership with the schools for helping us to get the word out to families about the events. We had the North Shore Healthcare Foundation help donate some thank you gifts to the kids for coming in to get their vaccines. The co-op donated lollipops that kids could take on their way out. And the events were really smooth. They ran very well. And it was just really heartening to see all of the kids coming in with their parents to get their vaccines. So that was definitely a high point of this past month. We also are doing both first and second doses for people who need first and second doses, and that number is small, but it continues to trickle in. And then the big one is boosters. So we had planned for around 1,000 boosters this month, and we filled those slots and we wound up adding more. So we have large events happening weekly at the community center again at this point in time. So I would say that those are running smoothly as well. Our first large event. It's kind of like getting back on a bike after a long winter. It was a little bit rocky at first, but after the first hour or so, I think we all kind of remembered the flow of things and got all the technical hiccups out of the way. And they've been running smoothly since then. I do think, so moving into communications and engagement, we've been very strongly focused on direct pandemic response this past month. So the contact tracing for those 52 cases, all of the vaccinations happening at the community center, conversations about setting up this testing pilot with the schools. So it's limited our capacity to do proactive communications. However, we have made sure to prioritize having the hub site up to date, having media releases about the booster availability, the pediatric vaccination events. And we've also done quite a bit of help over the phone for people who need a little bit more assistance with registration. And so I did the math last night, we've helped about 175 people with registration over the phone. Unfortunately, some people have had to wait a few days for callbacks, which our original goal is to get back, within a day, but the reality of the past month has made it so that some people do need to wait a little bit longer. And finally, we thankfully have some support coming on board from some of our colleagues within PHHS who are able to help kind of add extra hands to that registration support process so that hopefully this week, starting now, we're able to get back to people a little bit more quickly. And then finally, I mentioned last month we were going to be adding that age range breakdown to the hub site, and that did not happen this month, just simply because we were so busy with the pandemic response. But our goal is to have it go up this Thursday with the weekly updates, and that would be a monthly age range breakdown of cases. So a bit more detail, but not the level that would compromise data privacy in any way. So it's been a very busy month. I imagine there are questions from the board. I'm happy to take those questions. If I can't answer them, I'll do my best to find the answer, but thank you again for inviting me to be here and to give these updates.
Well, thank you for being here. It's important to hear from you, and I appreciate the opportunity. And I just want to, I am excited that we are testing at the school. So I just want to be clear that my reason for moving it was not because I was opposed to it. I think it's great. I just wanted to make sure you had an opportunity to speak to the public first.
Absolutely.
Before I had asked any questions. But, so do you see this testing happening, like you said, on a weekly basis and I'm hoping people take advantage of that if that is what they want to do.
Right.
How are we paying for the tests? How is that working?
So we're in the process of establishing a contract with ISD 166, and they have access to testing supplies through the Department of Education. So the test kits themselves, they are at no cost.
Okay.
We also have access to some testing supplies at no cost through the Department of Health. So while there are costs in terms of what we call the ancillary supplies, so for example, the PPE, the biohazard bags, the cartridge reader, the actual testing supplies, there will not be a cost to the county for those.
Okay, thank you. Yeah, that's just wondering how we're paying for this. And, we've all heard that there's shortage of testing, and I'm like, well, how are we going to make this happen?
Well, so they do, at the state level, they are prioritizing access for school families just because it's, the group that's the most newly eligible for vaccine. They are seeing statewide so many cases coming through schools that I think that's kind of a strategic priority on the part of Minnesota to try to make sure that even if there are supply chain shortages, it doesn't impact the schools as much as it otherwise would.
And so I get that you're going to focus mostly on middle school, high school staff. Makes sense. What about our outlying schools? So will they have opportunity?
We did. So we have a weekly group that meets with leadership from all 4 schools, and ISD 166 has been the most, they've been the entity that approached us and is really interested in forming this partnership. But I do think that it's important to provide access to other schools throughout the community as well. So my initial vision is to be on site at ISD once a week and at the community center and perhaps at Birch Grove as well. However, we have to work out the details with Birch Grove and make sure that that's going to be I guess an initiative that works for everyone. So there's a lot of planning to be done, I would say. And then in Grand Portage Health Services is able to support Oshkosh Ogumag with testing. So I feel like they've got a good working partnership in that sense.
And will families have to sign up, register ahead of time? Or I suppose you're still figuring it all out.
Yeah, we are still figuring out a lot of the systems. I think that it would be ideal. I mean, because especially if you're talking about students, the parents would have to be providing the consent for their child to be tested.
Okay.
So it would make sense that there would be some way to sign people up and space people out so that there's that confidentiality and that there's not that kind of, I guess, clumping together of people. I'm trying to look for a better word there, but we're trying to keep people distanced, right? So I think it will probably make sense to have some kind of sign-up sheet just to make sure, kind of like with the vaccinations, we want the traffic to flow smoothly so that people aren't frustrated waiting for long periods of time and they're not all kind of congregating together either. But we have a lot of work to do with the planning on this one, so I would say we're in the early stages here.
All right, thank you. Well, I look forward to hearing how that all works out next month, so, yeah. Any other questions or comments?
I'd just like to make a comment. I think it's a great way to slow the spread, not only amongst the school, but throughout our community, and I just applaud your efforts. I think they're right on target.
Oh, thank you.
Commissioner?
Yeah, thank you. Thanks, Grace, again, for all that you do. I'm just trying to help some people understand the coordination that you do with the clinic and the hospital. Some questions have arisen to me in terms of, well, I go for the shot at the community center, but I'm a patient at the clinic, and is there overlap, or are you all working together?
So we, because of, the small kind of close-knit nature of the community, I've really decided the best way to make this happen for the volume of people that we're attempting to vaccinate is by partnering. And so Sawtooth Mountain Clinic and Public Health have really had this shared effort since the beginning, and North Shore Health initially was able to offer some community vaccination as well. And at this point, they are largely focusing on staff and care center residents in terms of vaccination. So the way that we've worked together with the clinic to support vaccination is Public Health takes charge of the online registration and the communications about registering and who's eligible, and working with MIS to ensure that the hub site has all the information there. And then the clinic tries to point people toward that as well, because we want to make sure that the clinic staff continues to have capacity to set up appointments for other routine care, and so trying to really funnel everyone through the hub site or to call us with help for registration has been the way that we've tried to just, I guess, concentrate things in one place. So the hub site has really served as that one place. And then the clinic, their role is they transfer the registration into their electronic medical record system before the event, so that they're the actual vaccinating provider. So their nurses are the ones actually giving shots to people, and they have a registration staff that's there at the events that signs people in, that makes sure they have all the insurance information. And the insurance information, there's not a cost to people to get the vaccine. However, people's insurance does reimburse a small amount to the nurses for the time that it takes to give the vaccine. So that's the primary role of the clinic, to transfer the system into their EMR and then to have the nurses actually give the shot and document that vaccination in their EMR. And then public health, we also have taken the lead on volunteer management. So we have volunteers through Minnesota Responds at all our vaccination events. And then one of the staff from public health is the person organizing all of the the Minnesota Responds volunteers at the event. So everyone will sign up for like a discrete task, and then the public health staff will make sure they know how to screen someone in or kind of manage the flow of people to the registration table, or make sure they know where to go after they connect with the registration table and know how they would actually get to the vaccination station. They help in the observation area, so they're giving everyone information on how long they need to stay, how to connect with the vSafe app. Sometimes we have patient education on what to expect after vaccination. And then if anyone needs additional assistance in the observation area, they'll flag down the nurse, and then the clinic's nurse would be the one to go help. And then we have volunteers wiping things down. So the volunteer manager from public health makes sure all the volunteers are aware of what they should be doing, if they need to take a break, making sure they can take a break, making sure if they need a quick snack. We always have granola bars and water, so it's not that fancy, but it's something. I mean, the volunteers are there for several hours. And then we typically have another public health staff that can help if there are extra doses or cancellations, and calling additional people in to make sure that we're not wasting. And that's essentially how the collaboration has gone. So we have a weekly meeting to try to plan out, where we have staffing to support additional capacity for additional events. We have a weekly planning meeting, and sometimes, honestly, we probably connect more than once weekly. It's probably more like 2 or 3 times, just to make sure we're all on the same page with the events that, like, for example, yesterday, I realized over the weekend, all our events filled over the weekend. And so then we added more slots yesterday so that we can continue to get people in. So that's essentially how the partnership works.
Great. So in some parts of the country, they're lowering the age for the booster, and you're still dealing with people who haven't had the first vaccine, so.
Well, I think across the country, that is also the case.
Yeah.
We're tasked with prioritizing people who have not gotten their primary vaccination series. And it's not a large number, but we do have people every week coming in who haven't received any COVID vaccine, and we want to make sure that they don't get crowded out there's a larger volume of people looking for boosters, so we're trying to kind of accommodate both at this point, and that's, I would say, nationwide.
Right.
And I would say, to the point of like changing the criteria for boosters, that we don't have a lot of leeway on that locally. However, we don't, it's basically on the honor system. If someone says, I have an underlying medical condition, or I live and work in a high-risk situation, we take them at their word and just trust them and get them in. So I wouldn't be surprised if at some point they broaden the criteria for boosters, but at this point we're following what the CDC put out there. So.
Okay, thank you.
Yeah.
I just have a quick comment, Grace. My wife and I were at the tail end of that first hour last week, or 2 weeks ago, and I didn't see any problems. It looked great. I know it was well hidden, but people were coming in, everybody was lining up, everybody was cooperative, the staff was good-natured and cooperative, and if there were problems there, they weren't that big.
They weren't. I think I'm the one who gets to see them. I'm the one who kind of scuttles around in the background looking for supplies and things like that. But I'm glad
I thought it went well, and it's like the other times that you've done it. It's a wonderful service, and it's a good way to protect the community. Thank you.
It was good to see. It's good to see people coming through. It's a good atmosphere. We did, for the kids, bring out some Disney movies for the waiting area, and I had one adult say we should do that for the adult booster clinics too, so maybe that's a piece of advice to take to heart.
But thank you, Madam Chair, and thank you, Grace, and I'm just really, really excited for the partnership, because when we think about how COVID has impacted and can impact our community. I just see a really huge impact with the middle high schoolers and how much of a disruption that can be, and how interactive they are with each other, and just how things can really get out of hand without the routine testing. And so I just really appreciate your work towards this partnership and just trying to really address things strategically. I think it's just really impressive. Only request or soft request I would have is, and I know you're sensitive to all of everyone's personal sensitivities, but just if there could be like a even just a curtain for routine testing sort of situation, just for the, I know there's
I think
teenage
that's a good,
sensitivities
right.
with.
I think that's a good suggestion. And I'll work with the school on that. And we did get some dividers for the pediatric vaccination
Okay.
events that if we do testing at the community center can be repurposed to provide a bit more privacy. They're actually really nice. It's a nice addition to the space.
Oh, great. Well, thank you.
So thank you for that suggestion.
Yeah.
Any other comments or questions for Grace? No? All right. Thank you, Grace. Really appreciate you coming in.
Thank you all. Happy to be
Updating
here.
us.
Feel
Thank
free
you.
to email with questions in the meantime if you have them before next month.
Thank you.
Thank you.
Okay. We'll move on our agenda, and we have a staff report from Allison Plummer. Thank you for coming and presenting to us today.
Yeah, you're very welcome. Good morning, everyone. So I come every year about this time to give an update on how we're doing in economic assistance. Our income maintenance team upstairs that works with economic assistance and healthcare programs. So just kind of a kind of looking back on what we've seen for the year of 2021 thus far, even though we still have a couple months left. So just to start, just giving some basic information about what we do. So we, the Income Maintenance Unit, administers financial assistance programs to help low-income county residents meet their basic needs. So some of the programs listed here are programs that we administer and work with. So we have child care assistance, and of course everything has an acronym, so the acronym is listed after that. So sometimes I just naturally will say the acronym instead of the full name. So we have child care assistance. There are cash programs for families, so the dependent children are in the home, and that we have the Minnesota Family Investment Program and the Diversionary Work Program. We have cash assistance for what we call single adults or married couples without dependents, so no young children in the home. And those include general assistance, housing support, and Minnesota supplemental assistance. We have emergency assistance for families and adults that are experiencing some type of housing crisis. We administer the healthcare programs, including medical assistance, Medicare savings programs, long-term care services, and then our healthcare access reimbursement program. And then the big one is SNAP, the Supplemental Nutrition Assistance Program, but there are definitely more programs that we administer that aren't listed on here. And what does it mean when I say like we administer these programs? So it often involves meeting with people in person, less so in person over the last couple of years. So mostly over the phone, and we discuss the household's income, their assets, expenses, and any other information that's needed to determine what programs and benefit level people may be eligible for or qualify for. And then we also review information on a regular basis, and that is because we need to redetermine every so often if people remain eligible for programs and also at what benefit level. The population that we serve through these programs is really everyone. So we serve county residents or residents who are in placement out of county. So think supportive housing, they're in treatment, they're in foster care. We serve all ages, people with disabilities, families, single adults, people who are employed, unemployed, and then just kind of the big key for most programs is that the eligibility is really determined based on someone's income or a household's income. Okay, so getting to some more kind of down to the nitty-gritty stuff, caseload update. So our total caseload, so if we look at all of the programs we administer and looking at the current caseloads, the active cases, our total caseload for the county has steadily increased throughout 2021. It's actually the highest caseload count we've seen since 2015. Most individual programs have remained steady with slight fluctuations. That's quite normal from month to month. Healthcare cases, though, have actually grown each month since January of 2021. And of course, the COVID-19 public health emergency continues to have an impact on our caseloads. So I'm going to go kind of program by program to just show you kind of what the trends are in our current caseloads. This information, I believe, was in the packet, and I know I could talk like for a couple hours about this stuff, and I know we're on a limited time, so I'm going to just kind of skirt through things, but please let me know if you have questions, because again, I could just go in depth on a lot of this stuff. So our first one is Ccap, the Child Care Assistance Program. So this program helps families pay for, helps assist by paying child care costs for working families. So most of the time families still have to pay a portion of the child care, but this is really just an additional benefit to help cover a majority of that cost. Because as we know, as I know, daycare is very expensive. So we have currently about, 5 cases, and this has remained steady really since the end of 2020. But you can see the trend over the last 5 years or so. We have significantly seen a pretty severe decrease in those families in our county that are receiving the benefit of Ccap. Next one is our family cash programs. So we have the Minnesota Family Investment Program and the Diversionary Work Program, or MFIP and DWP. So right now we are currently sitting at, these are figures at the end of October, we're sitting at 15 active cases. So again, similar case trend has been fairly steady, even looking back into even all the way back to 2019. You can see going back to 2017, we had much higher cases. The all-time high we had in October of 2016 with 38 families receiving benefits from these programs. SNAP, or the Supplemental Nutrition Assistance Program, or what we call food support, or the old term food stamps, is the food benefit. And we've seen a caseload, the caseload kind of increased at the end of 2020 there, and then kind of, and going into the beginning of 2021. Again, slight fluctuations, that's completely normal. And then there's been a kind of a decline, just by a little bit over the summer months. Again, lots of factors that could go into these fluctuations, especially with all of the different waivers that we've seen in place, and I'll talk a little bit about that more later. But waivers, we've seen the different types of pandemic-related relief payments people have seen and how those are treated in cases. So maybe people become over income for programs, or they're receiving those benefits and then no longer need SNAP to supplement their food bill each month. Now, the Minnesota healthcare programs, so this includes medical assistance and Medicare savings program. So this is the one program that we have seen a steady increase each month. I mean, significantly even from 2020, we've seen an increase. And a lot of this is due to the waivers that have been in place since the start of the pandemic. The healthcare programs, so medical assistance, Medicaid is a federal program, so we are following federal waivers, and we actually are really restricted in what we can do as ongoing maintenance for healthcare cases. We cannot really, except a few circumstances, actually close someone's health care right now. So people who were eligible for medical assistance prior to the public health emergency, unless they call and request closure, we call that voluntary closure. Maybe they move out of state, or unfortunately they've passed away and they no longer need the health care coverage. Outside of those three situations, people who were eligible for medical assistance have continued to retain their medical assistance. Even if they've called and said, hey, I got a new job and I'm over income limits, they still have retained medical assistance. So that has definitely impacted the case trends that we see those people remain eligible, even though after the public health emergency ends, they may no longer be eligible, but then we've also had people experience circumstances where then they've applied for healthcare coverage. So it's just kind of that compounding effect that we've continued to see that increased trend. This is a new data chart that I included. This hasn't been in past years, but I wanted to give you kind of a snapshot. Not only do the financial workers do ongoing maintenance to active cases, but we always have applications, new applications coming in for programs that also requires a lot of processing, actually a lot of time to go through the various programs that people are applying for and to go through the process of talking to them, doing the interview, gathering the verifications that we need. So I feel like it's another important piece of data that kind of goes into the whole picture of what the financial workers do. So this is the total applications that we have received. And so I went back and grabbed the data back to 2016. So you have the various colors there down below on the chart and then the total. Now it kind of drops off at the end just because we don't have the last 2 months of the year yet. So potentially still expecting to see that trend increase. But you can see that the total apps from 2016 on through 2021, again, year-to-date 2021, we've seen an increase in received applications steadily from 2016. So this is the number of applications that we get. Again, all of that processing that's involved. And then that doesn't even mean that these applications were approved, that these people were eligible for benefits. A lot of these applications, people don't meet eligibility requirements and they end up being denied. So again, that's additional work, and then we don't end up usually having an eligibility result at the end. So I did include most of the programs. So we have food support, any of the cash programs, emergency assistance, which is a very important program, especially right now with housing crisis. But I just wanted to note the healthcare, the HC line. This actually only represents the number of applications received for a specific population that we work with. This would be for what we call like the elderly or disabled adults. They have a different application or more like in-depth application process that we have to go through with requesting verifications. They're subject to an asset limit, so we have to go through and request all of their asset verifications. This does not include applications that have been submitted to what we call MNsure. We call it METS. Everything has a different name. But people who apply in MNsure through a paper application, or they mostly do it themselves online, are not included in this, because a lot of times those applications we don't even touch, again, especially if they apply online, and we don't usually see a lot of paper applications. So this is only reflective of, again, the more elderly population or disabled individuals that involves more processing. So just a snapshot in terms of looking at within the number of cases, how many people are we actually serving? How many people in our community are benefiting from these programs? So again, as of the end of October, 195 people were receiving SNAP. So again, that includes the entire family, adults and children. The average benefit per person is about $231, so that's pretty significant. About 18% of our SNAP recipients have earned income. So that means that they are employed or maybe self-employed. And 27% of those SNAP recipients either receive retirement or some type of disability income, so RSDI, SSI. So a lot of our individuals who receive SNAP probably don't have a source of income at this time. We have 15 families receiving cash and food assistance through MFIP. So MFIP pairs a cash benefit with a food benefit, so those people are not technically included in our SNAP numbers. And this is servicing 14 adults and 27 children. Interestingly enough, we've really only looked at the MFIP program. We've only determined eligibility for MFIP over the last almost 2 years because DWP was actually kind of put on hold because of the pandemic. DWP is what they call more of a fast-paced employment program. It's basically like, you're able to work, let's hit the ground running, working with an employment services counselor, let's find you a job and get you working so you can be earning that income. And it only lasts for 4 months. So it's a pretty quick program. Well, that's a little hard when we were experiencing a pandemic. A lot of businesses were closed. So DWP really just technically reopened for us to be able to determine eligibility just this September. So most of these families that we've been servicing have only been on MFIP. The average benefit per person is about $483 per month. And about 1/3 of our MFIP participants are working or they have a source of earned income. We have 29 adults without children receiving cash assistance through general assistance or MSA. The average benefit is anywhere from like $118 up to $176. It's much less for single adults than it would be for those with a family. And this population that we serve through these programs is generally unable to work. Usually there's some type of incapacity that doesn't allow them to have full-time employment or really any type of employment. So most of these recipients are receiving currently or applying for Social Security disability. Now the big program, Minnesota healthcare programs, we have 1,124 people eligible for medical assistance. I actually went to look at what our census numbers were, and that's about 20% of our population. It's pretty significant. We have 960 people who we determine eligibility for in what we call METS or MNsure. So that would be like families with children that apply in that program. 436 children are receiving medical assistance through that program. And then we use another program, the same program that we utilize for determining eligibility for SNAP and the cash programs. We call that Maxis. It's a DHS software program. That is where we determine eligibility for those that are elderly or disabled. And we have 164 people right now eligible in Maxis, with 35 of those being children. I mentioned Medicare savings programs earlier. We currently have 99 people receiving help, and that program helps pay for Medicare Part B premiums, which I don't know if you guys saw the news this weekend, but that is going to be a very beneficial program starting in 2022. So hoping to maybe do a lot more outreach, not only by this presentation, but WTIP, and then hopefully the article wasn't in the paper on Friday. We're trying to fix that, so hopefully that will get in there and we'll get more outreach that way too, but that will be a very beneficial program. One of the other programs that we administer is emergency assistance. So this program helps families that are experiencing an emergency related to utilities or shelter. They're at threat of losing an item of basic need. So heat, electricity, maybe they have an eviction notice, maybe a mortgage foreclosure. Funding is limited, so we usually allocate about $5,000 per year for what we refer to as the MFIP crisis funds. That is the crisis funds specifically allocated for families. And then about $1,000 each year is allocated to what we call the emergency general assistance funds, and that's for the single adults or married couples without children. Now, we've still seen a handful of applications. I think it was about 15 applications thus far for emergency assistance this year, but we have only approved one of those applications because the other applications did not meet eligibility requirements. So thus far, and historically, we have severely underspent our allocated funds, which I don't know if you recall, we did some modifications to the emergency assistance policy to try to get more families eligible, and still there's some factors out of our control. But thus far, we have approved $596 for one household that was subject to some utility disconnect. But I did want to mention that even though we have our own emergency assistance program, there's currently Rent Help MN. That is a state program that people can apply for, and that was funded through some additional COVID relief funds through the federal government. And that is a very similar assistance program that people around the state can apply for. So it's kind of like, well, if people aren't really applying for us, are they at least seeking help somewhere else? And yes, they are. The Rent Help Minnesota website actually has a live dashboard. And when I went in and checked it last week, there have been 17 applications submitted by residents in Cook County. So if we can't help them, I hope that they, at least they're applying somewhere else. And I don't know the status of those applications, but at least there's other assistance beyond what we're able to help people. So staff updates, we continue to have 4 full-time financial workers working in all of the different programs. Every worker works with all programs because we case bank, and case banking means there's no one specific financial worker assigned to a case. We all have access to all of the cases, so if a client were to call and have a question, if they talk to one financial worker one day and then that person is gone and they talk to another one, everyone has access to the same information. So everyone works on the same programs, just efficiency across the board. And as I mentioned, we work with a couple of different software programs to determine eligibility. So we have Maxis, which is really like a green screen MS-DOS type program, not web-based application. We have METS, that is what people know as MNsure, that we work in. And then with those 4 full-time workers, 2 of them, we have Agni and Kathy Ann, that are specifically trained in, that work on long-term care cases. And they currently, right there, just the long-term care cases, they have 62 cases. We also have a case aid position specifically for income maintenance. And Sarah works out in the front desk area. So she does a lot of scanning. They do initial entry of our applications and our programs. She issues EBT cards. She's also our healthcare access coordinator. So she is the go-to individual for people who they have questions or are submitting reimbursement requests related to the healthcare access program. And just some general program updates. Again, we've experienced lots of changes in our processing and our program standards since the start of the public health emergency, and those have really just continued up through even into 2021. So there were a lot of waivers that were applied for all the various programs, and each program was affected differently, and that just really limited what we were able to do, and a lot of that was because the state and the federal governments just wanted to ensure that people were still receiving benefits during these very difficult times. However, a lot of those waivers were tied to the timing of both to the state and the federal declared public health emergency. And the state public health emergency ended on July 1st, and so the state was going into a phase-out period. So over a 60-day wind-down period, they called it, they were going to phase out SNAP and cash waivers. So again, not healthcare, that's federal. Those waivers still continue. So as of September 1st, we are basically back to normal processing standards that we followed pre-pandemic. So basically what our workers really know, and not having to constantly reference, like what has changed, how do I do this now? So one of the things, again, I mentioned DWP was a program that we were able to determine eligibility for. We are doing recertifications, so those yearly basically reapplications for SNAP and cash programs. Monthly reporting for some of these programs has started back up. So we're really starting to see a lot of our normal processing pick back up. As I mentioned, healthcare cases are still being affected by the federal public health emergency. So again, we're really limited. It's a lot of hands off on those ones. We don't want to remove anyone's coverage. But we're anticipating the state, based on discussions with the federal government, we're anticipating restarting those renewals and those annual check-ins in April. And that has been consistently pushed back as the federal public health emergency has been extended. But the state is constantly preparing for those potential changes that will come up in the springtime. far? How am I doing on time? I'm good, okay. Okay, so performance goals for Expedited Snap. So this is important because SNAP is technically a federal program, and there are specific guidelines that we have to follow, specifically when it comes to performance or timeliness on processing these applications. Now you're like, well, what's Expedited Snap? I don't know what that is. So Expedited Snap is basically like we expedite the processing and approve benefits to get to families who meet specific requirements. Basically, like they need this help right away. They can't wait potentially like up to that 30-day processing time frame. Like they need to get this money now. So usually those are people, households that have less than $150 in gross income and less than $100 in liquid assets. So, you know, not much money in their bank account, not much cash in their pockets, and they don't really expect much for income. Or in instances where their monthly expenses for shelter and utilities is greater than what they expect their income to be. So those are basically the two situations where we see families qualifying for this expedited service. So if someone is determined eligible for these expedited benefits, we have to process and approve benefits within a specific time frame, and we have to meet specific thresholds. So there are 3 measures that the state and the federal government look at. One is approving within 24 hours. So we get the application, we do all of the stuff that we need to do, the interview, approve benefits within 24 hours. Then there's the 5 business days and 7 calendar days. So the one that we do actually have to meet is the 5 business days. That's the big threshold. We have to have at least 96% of our applications that were eligible for expedited also be approved within that 5-day time period. So we're a small county, technically, small in population, so we don't usually see a lot of applications. So even missing one application with meeting the time frame, like we process it in 6 days, really makes our percentages swing. But we are doing pretty good. So the 24 hours, again, they'd like to see a high number on that, but there is no specific requirement. But currently, these figures are up through the end of August. These are the approved figures by DHS. So January through August of 2021, looking at the expedited 5 business days, we are at 100%, so we are meeting that 96% requirement. And I'd like to just give a big shout out to the financial worker group, and Allison has brought these little kudos, I think, to the board meetings as well, that when we meet these processing timeframes, we get a nice certificate from DHS. So the financial workers have done an amazing job. We received certificates throughout the year of 2020, and thus far we've received certificates for achieving these thresholds for Q1 and Q2 thus far in 2021. I'm almost done. Okay, looking ahead. Okay, so we're steadily returning to normal processing standards, which is nice because it's been really hard. It's a lot of work to keep track of all of the various changes, waivers to the programs that the financial workers have had to really kind of navigate over the last year and a half. So kind of even relearning a lot of this stuff as we go back. So again, even with some programs having already returned to normal processing, we're anticipating healthcare will do the same next year, which will be make it much easier then to just kind of have all these cases rechecked and kind of back to current information, and doing ongoing maintenance will make it much easier. There's been a statewide launch of this new online application platform called MN Benefits, and this program is set to replace the current DHS online application platform called Apply MN. So we actually joined the spring testing cohort. We were one of the smaller counties selected to participate in the testing of MN Benefits, and just really kind of before they did a statewide launch, we were one of 16 that were testing the program. And I think we've received, I think it was around like 25 applications thus far since we launched my dates in my head all. 2020 and 2021 just all seems to kind of mesh together. But we've received about 25 applications through that online platform since we started testing it. And it's an easier, more efficient online application process than using Apply MN, which is why the state will phase Apply MN out, and everyone in the state will be using MN benefits. We are excited for the new county website. It is beautiful, it's amazing, and we are looking forward to really utilizing the new website to do a lot more outreach to the public. The old website didn't have as much information that we would like to provide. We want to get forms out there. We want to put notices. We want to put the available information out there for the public to be able to access. And we look forward to doing that. Progressively, we'll identify those items to add to the new county website. So that will just increase our amount of outreach so people know that they can come to us if they need help. Oh, but then that's followed by anticipating a SNAP management evaluation review. So basically, this is going to be like an audit of how we are doing. And that's okay. These are great things to go through. We went through one in 2019. There were some items that were identified back then that we needed to improve upon. And so we have been working on those items ever since. So through to 2020 and 2021, we had a corrective action plan. We will hopefully fulfill that and meet those requirements as we move into another review. So again, this is DHS's way of evaluating performance outcomes and just seeing where they look at cases, they review cases that we've touched. And these are just SNAP cases. Again, this is because it's a federal requirement that they do this. So it's all good, and we look forward to identifying areas that this would be awesome. If we don't have a corrective action plan, that means we're doing awesome. But that's okay if they identify areas that we could continue to improve upon. We have on the agenda for later for an item of action, a slight change when it comes to our policy for the healthcare access reimbursement program. So I'm just going to stick around if you guys have questions, but ultimately just kind of the background on that is, being progressive in adjusting policies where needed. In our old policy that really hadn't been revised for many years, at least when it comes to what is reimbursable, because that is following state requirements, state policy, is that we had specific language in there that gas station and grocery store receipts are not reimbursable. Now, the state policy for healthcare access says groceries are not reimbursable, but obviously things in life progress, and we have places like Holiday and Quick Trip that offer meal type options, right? And so a lot of times we're seeing clients who, hey, I need to go to the bathroom and I'm hungry. So they stop, and it's a one-stop shop for all of their needs. They pick up a meal option. They're not swinging through the drive-through of McDonald's, for example. Well, according to our current policy, we deny those applications or deny those receipts. So if we see Quick Trip, Holiday, or even the grocery store that has like a deli section, we've had to deny those receipts. So just trying to, again, be progressive and respond to those changes in our economy that we're seeing. Not many of those receipts come in, but we want to be able to accommodate the fact that we have this program to reimburse people for those expenses, and we want to be able to provide that reimbursement, and more so because then that is consistent throughout our region too for the other counties that are also reimbursing those meal type items at gas stations and grocery stores. And then the other big one that we are working on is we are working on renaming our unit or renaming our team. So currently we go by income maintenance. Well, we don't maintain anyone's income. It's a very old school term. So we're changing our nomenclature to match really how DHS has modified their language too. So they refer to everything as economic assistance programs, economic assistance and healthcare programs. And so you've even kind of probably seen some of that language change as we talk about it. Or I think Lori has modified her language and her budget to say economic assistance versus income maintenance. So we've slowly been internally updating how we refer to these programs. And so we will formally, we're planning on kind of still drafting the the actual names, the reference that we're going to go use starting in 2022, hopefully January 1st, especially now because we have the new website, which will be perfect timing to be able to really just create a whole new nomenclature of what we do. So we'll phase out of income maintenance and probably go with something like economic assistance team or economic assistance unit, which will then also require us to modify our email that we use as well for clients. We currently have im@co.cook. IM stands for income maintenance. So that's just something that we wanted to be current with our terminology. Because again, income maintenance is a very kind of old school term. I'm done. Okay. Again, I could talk forever about this stuff.
Thank you, and your passion comes through clearly. I appreciate it. I appreciate you explaining your slides too, because I did have questions, but guess what? I'm ready. Yeah, that answered that one. So I really do appreciate you taking the time to put your slides together and explain them to me that I can understand. So thank you so much.
Yeah.
I don't have any more questions. Anybody else have any questions or comments? Go ahead, Mr. Sullivan.
Thank you. One question I had, and as I was reviewing your PowerPoint prior to the meeting, I was thinking about the number of families in Cook County that are receiving medical assistance. 20% is a huge number.
Mm-hmm.
I'm curious if you have data on, of that 20%, how many are working full-time?
Ooh,
And
good
still need medical
question.
assistance?
Good question. I have the ability to query some of the information. I think that would be easier to do in the Maxis program. I have more ability. I don't know if I would be able to pull that information from METS or the MNsure system, so I have some limitations. But I honestly, I don't know what that data would even look like. And knowing that the information is very out of date as well. Since the public health emergency started and they basically said, like, don't touch healthcare, people have not reported changes. And even if they have, we don't make those changes because we don't want to negatively affect their assistance. And MNsure also goes through a process of yearly renewals, just like anyone else has to do. But sometimes those are automated, and the system is tied to various electronic data sources, so the IRS, Social Security Administration. So when someone is selected, the system automatically selects them saying, hey, you're going to be due for renewal. This case is going to be due for renewal in 45 days. It goes through and will reach out to the various electronic data sources, matching like Social Security numbers, to try to verify, like, is income accurate? Is income within the realm of what they're reporting? And so some people have actually been automatically renewed, like they don't get a paper form that they have to fill out each year. The system just automatically renews them. And so if the information, again, seems kind of within the realm of what the electronic data sources can verify, people have just continued to receive eligibility year to year. But then the public health emergency started and renewals stopped. So even if someone's information has changed, you don't report it, the system is even if the system is trying to do automatic renewals and can't verify information, we just automatically we do a manual process to renew them. And I actually do that each month to ensure that someone remains eligible. And so some cases during the public health emergency and just doing all of these renewals to ensure that people are still receiving benefits, even though they're not reporting their current information. Some cases have already gone through 2 years of renewals. And even then before that, there might have been some automatic renewals and we weren't getting more updated information, say on earned income, things like that. So I think even if we were to query some of the information, just of the logistics of the last couple years and the waivers in place, it might not even be, I don't know how accurate it would be too. Because I see some cases, just personally, like small county, we know people like, oh yeah, that'll be a change that we'll have to make. That'll be a change that we'll have to make. So I guess I went like all over your question. So I think it's possible to grab some of that information. There's limitations in the information we can pull from cases, but I don't know how accurate it would be considering the circumstances over the last couple
And
of years.
perhaps it would be something to look at in the future. I just,
Yeah.
really wonder about, in our community, do we have a living wage? If we have 20% of our population on medical assistance, and I think it would be valuable to look at down the line when we have some accurate data.
Yeah. And one thing to note too is there are different income limits depending on ages. So adults 18 and over have one of the lower income limits. But if they have children under the age of 18, usually that income limit is significantly higher. So a lot of times we see what we call like mixed households, where the parents are, say, eligible for Minnesota Care or one of the tax credit programs, or purchasing a private health plan because there's a higher income limit, but the kids may be eligible for medical assistance. So what was my point on that? I don't remember where I was going with that. But that can affect it too. So I mean, in terms of like, parents are earning a living wage, but they're still, because of the age of their children, are still able to receive that really big benefit of being eligible for medical assistance.
All right, thank you.
Madam Chair.
Yes, go.
So Allison, a great presentation, and I'm sorry if you address this. When I see a table in a slide presentation, I start focusing on the data and sometimes don't process as well. But I was noticing that the number of participants in the child care assistance program is lower than it's been for the last 5 years. And we've all heard a lot of discussion recently about the lack of available childcare in the community.
Right.
And I'm just wondering about the relationship between these trends. I would guess that the level of participation is in part a reflection of the fact that we don't really have a lot of childcare, and so people aren't subscribing to that program. Is that, and do we have data to speak to that possible correlation?
Data-wise, probably. I'm sure, I mean, it's with like 5 cases, yes, I'm sure that the data would support that. And that is one of the effects of why we have such low caseloads. And this feels, Alice and I were talking about this too in preparing for this presentation, of like, we've had this conversation, this important conversation before, I think even last year too, of like, oh my God, Ccap, this is a huge benefit. Why do we have so few people utilizing this program? One is supply and demand. We don't have a lot of childcare providers in the county. And for those spots that are available, a lot of times we find that the families that can afford the childcare have those spots. And those families that can afford it are not income eligible for Ccap. So again, kind of comes down to that supply and demand thing. Also, one of the big issues, and this really needs to come, a change needs to be spurred at the state and federal levels, is the income entry level limits for what we know as the basic sliding fee child care assistance program. So just to know, people who apply and are eligible for MFIP or DWP are automatically eligible for child care assistance. We want them to find work, so we need to pair it with child care assistance, right? So the basic sliding fee would be people who are not currently receiving one of the family cash programs. So like myself, like me and my husband, we're like, child care is expensive. I got 2 kids I gotta pay for. I'm gonna go and apply for child care assistance. That would be the basic sliding fee program. Child care assistance, that would be the basic sliding fee program. It has a really low income limit to enter the program. I think math-wise, I was trying to recall last year when we did the math, let's say there's 2 working adults in like a 4 unit household, so 2 parents, 2 kids. I think it was like 2 parents working full-time, they'd have to make less than $12 an hour. And I mean, realistically up here, most jobs are going to be paying over $12 an hour. So we find that most people are not qualifying income-wise, because you'd have to really not have a lot of income to be able to pay for that, which then is difficult because it's kind of like chicken or egg kind of thing. Like, then you have people people can't be currently working to be able to get on Ccap, but then how are they going to find a spot when they do become eligible? And then just one of the other factors is pretty small. We do have even though we have just really a handful of providers in the county, not everyone accepts Ccap. There's additional paperwork and qualifications and checks that they have to go through with DHS to be eligible to receive Ccap funds on behalf of their families. So that kind of also could potentially become a barrier.
Yep.
So lots of different factors, yeah, absolutely. And I'd love to see those numbers back up to where they were 2017, 2018. I don't think we'll be there for a while, unfortunately.
So have the income guidelines changed from 2017?
They change slightly from year to year,
Okay.
basically reflective like inflation and COLA. But there's been no significant changes in income, especially to acknowledge the really low entry limit for families to just initially qualify.
Yeah, I looked that up online and I was like kind of amazed thinking, well, doesn't even make sense.
Right. And they've made other changes. They've increased the maximum rates that providers can get paid. So that has increased, acknowledging, and say like a provider is, the cost is $40 a day. The Ccap would maybe reimburse like $30 of that. Then the family would have to be responsible to pay the rest. They've adjusted those rates to pay to reimburse the providers more, so the families have to pay less out of pocket. One of the other changes several years ago was the low entry level income limit. If people qualified that, they got on the program, they started making more income, they could basically double their income during the 12 months of eligibility. All these programs, I'm very like animated. All these programs go by a 12-month eligibility period, and then you have to reapply or go through a recertification process. So someone could basically like double their income during that 12-month period and still be eligible for Ccap. It's just that initial entry income limit has not fluctuated much.
Any other questions or comments from? Yeah, go
I
ahead.
have a comment, Commissioner Huggins, to Administrator Yorkey's question about childcare availability. You may have seen this in the notes from our Public Health and Human Services Advisory Council, and we'll have more information next month at our board, but with a recent study conducted by Wilder in collaboration with the Early Childhood Coalition and their studies on early childhood needs in Cook County and Grand Portage, found that there are 220 children under age 5 in the county who would be, where families would be looking for care for these children, but there are only 66 available spots, so a pretty critical deficit in terms of childcare availability for families.
Yes.
Yeah, and I really appreciate the presentation as well, and the data, both Allisons for that. And I appreciate it every year, and it's just always so important for us to hear. It's also very sobering, but also very motivating. And yeah, we've focused our conversation quite a bit lately on housing. And whereas that's absolutely an important factor in our community's health and well-being, I feel like we have some pretty good momentum, and we're starting to really gather more tools with the HRA. I also see childcare being a really integral part of that our community's well-being again. So seeing the presentation from the Wilder and hearing those numbers and just seeing our community's needs, it just all helps us gain the perspective we need to be able to address these needs. So thank you for your work and your presentation. Again, it's always very, very insightful. So
You're very welcome.
All right, thank you very much for all your work and coming and telling us all about it, so I appreciate it.
You're very welcome, and I'm always happy to answer questions outside of this, because again, like I said, I could just probably go on forever talking about this stuff. And I love what I do, and we love helping people. So yes, I'm available anytime.
All right, thank you.
And I'll stick around too, just in case there's questions related further to the healthcare access.
All right. Okay, then we'll move on in our agenda to our director's report.
Great. I'll just keep the recognition for Allison going. Thank you for the presentation. Also want to call attention to all of the work that you've been doing on behalf of the county as a whole throughout the benefits open enrollment process. As you can see, Allison's very skilled and passionate about policies and outreach. So thank you so much, Allison, for doing that on top of everything else that you do so well.
Thank you. Thank you.
Continuing on with staff updates, we are recruiting for 2 vacant positions currently in our adult and home and community-based services unit. We will be interviewing this week for the adult services social worker, replacing the upcoming vacancy that will be created by Beth Benson's retirement in early December. We ended up reposting our in-home support coordinator position that closed on the 15th. So looking forward to seeing who else has applied and doing additional interviews for that position as well. I want to recognize and thank Martina Johnson for all that she has done over the last month in taking on the in-home support coordination during that transition. Anita retired in October, and Martina has taken on a great deal of work in continuing to support that program, coordinating the rides, matching service providers, all of that great service and coordination that's required for that program. In addition to those 2 social work positions, we are continuing to recruit for in-home support providers as well. Still looking for more service providers to be able to meet the needs that exist right now for those homemaking, transportation, respite, chore services. Since our last meeting, we welcomed Stacy Schmidt as our new Family Services Case Manager. This is the Child Protection, Child Welfare role vacancy that was created when Cooper Turnus transferred to Children's Mental Health. I neglected to get her on the agenda today for an introduction before the board, so apologies for that. We'll coordinate with Stacy so that you can meet her and she can meet you all at our December meeting. I want to recognize Grace Granager as well. It cannot be overstated, the contributions that she has made locally to our public health response. And this was recognized at a state level by the Local Public Health Association. Later this week, she will be receiving the Emerging Local Public Health Leader Award. So big kudos to Grace for all that she has done to lead our local public health response, and well-deserved recognition from her peers and other leaders at the state. Some of the examples cited by LPHA include active participation in their member engagement and outreach, her visionary leadership in the community for COVID-19 response, and advocacy for rural public health, and engagement in the LPHA's 21st century public health improvement efforts. So Grace was asked to serve on a statewide committee and is bringing the perspective of rural public health and our very unique public health model that we have here in Cook County that we transitioned to with the retirement of Joni Christensen from a primarily nurse-based direct service model to more of a community health, population health-oriented collaborative model as we have now and have had for the last several years. So big thanks to Grace. Department updates. I want to express gratitude to our maintenance staff for all that they have done over the last few weeks in our major office remodel project. So since our October meeting, we moved out the large workstations in some offices that had been mine and other supervisor staff offices, put in smaller workstations to accommodate 2 people in these larger spaces. So it was a major undertaking for our maintenance team, moving these very large desks and credenzas out to storage, and just want to say how grateful I am for their support throughout that. as well as all of the staff who, yeah, it's a major undertaking, as I said, to move space, and we are all still settling in, but it's good to have a spot for everyone to land. I wanted to share a note on the financial report that you approved on the consent agenda, just that the second half of 2021 property tax collection is not included in that report, as the auditor's office has not yet finalized distribution to all departments. So this will be reflected on our November financial report. Wanted to share something that was shared with me by Martina that I think is an interesting kind of secondary impact of the pandemic on our staff, beyond obviously our direct public health response, behavioral health response, the impacts on all of us as individuals living through this. But something that we're seeing through our work is our adult and home and community-based social work staff are seeing an increased workload in terms of assessments and information and referral and discharge planning for people in our local hospital. And this is something that's fairly common in other communities, other county agencies, where they are serving people from other communities. So Duluth, for example, is a regional service hub. People throughout the region come to Duluth to receive medical care. For us, at the end of the road, it's much less common for people to come here to receive medical services. But because of, as I understand, various factors, including staffing and bed capacity at other hospitals throughout the region, North Shore Health is seeing more patients from other communities receiving care here. So that impacts our staff in terms of that discharge planning, information, and referral, and is a bit outside their scope of practice and expertise to be connecting people with resources outside of this community or outside of Duluth. So I just thought that was interesting and wanted to share just another example of how the pandemic is affecting our workload as a department. We received notice at the end of October from the Department of Human Services Performance Management Team, so the same group that evaluates, as Allison shared, that application processing standards. They look at performance measures across all areas of our service delivery as an agency. And we received, as I said, notice in October that Cook County met or exceeded all performance standards in the areas of adult protection services and child support. So as an example, in the area of adult protection, one of the measures that we are held to is the percent of vulnerable adults who experience maltreatment who do not experience a repeat maltreatment of the same type within 6 months. So essentially, how is that person, continuing to receive services and supports to prevent future maltreatment? And Cook County for 2021 and for the 4 years preceding is at 100%. So none of the individuals who were screened for maltreatment experienced a repeat maltreatment of the same nature within 6 months. And what is as interesting to me as our great continued performance is just the number, the denominator. So there were 7 vulnerable adults who experienced maltreatment and were measured by this measure in 2021, and that's up from 2 in 2020 and 1 in 2019. So again, just a reflection of the increased workload that our staff is seeing, consistently outperforming our regional peers in that area, as well as the statewide average. For child support, there are various measures that we're held to. I typically receive an email from the child support supervisor from Carlton County as soon as the support report is released, just reflecting on the information. And he shared that he's excited to see we've increased in 2 of our 3 categories for child support, so increased that performance. And Dan also shared that he'll have a write-up early next year for the board, so a more formal summary on contract performance. You approved the renewal of the contract for 2022 on the consent agenda. So again, continuing to be very happy with that partnership for child support services. with Carlton County. Lastly, another major initiative underway in the last month for our department has been the administration of and support of the Public Health Fund process. Alongside our PHHS Advisory Council subcommittee, I prepared a report based on the subcommittee's recommendations under items for board action, which you saw on the agenda. Among our next steps will be pending your approval of those recommendations, notifying grantees of the 2022 award amount, and bringing the committee back together to further debrief our process from this year, talk about areas for improvement for next year, and some of the recommendations and changes in process for continued administration of that grant process. So that's all I have for my updates. Happy to address any questions with Roger's support.
Yeah, I've got one. I'm interested in the North Shore Health numbers from out of county, from out of the region. It's interesting that if we send somebody down to Duluth, St. Louis County, I'm assuming, must do the outplacement of the people from the hospital. And then if St. Louis County sends somebody up here, then we do the outplacement back to St. Louis County. Is that the regulation, or is that just the way things work?
That's a really good question, Roger. I'm not sure. I do know it's common for the county where an individual is placed to do that coordination. Mm-hmm. Often it's in collaboration with their resident county. Mm-hmm. I can certainly learn more from Kimber and Hilly at the hospital about what they're seeing. But as I shared, it's less common for us here at the end of the road to do that type of work.
It would be interesting to know the numbers and how much time our public health staff and human services staff is taking to do that. Mm-hmm. Because I know our people go down to Duluth if there's somebody in placement down there in a residential facility or treatment facility or wherever they have to go to do it, and it's still handled. And why this would be different, it's something I'd like to know more about and to better understand.
Absolutely.
And the numbers would be if it's just 2 or 3, it's no biggie, but, and it would be interesting to know just how many people from outside of Cook County are coming up and using our hospital.
Related question. I'm wondering, it's interesting to me that the county would have a role in discharge planning. My wife is a nurse and has worked as a nurse case manager and has done a lot of discharge planning. She works for a hospital. And I would have expected the hospital to oversee that function. I'm just wondering, is it typical that counties are involved in that kind of role, or is it unusual? Is it just because we're a small community? And
I imagine it's a combination of factors, and I would like to learn more from Martina and her team before commenting on that specifically, but I believe it is in part due to our size, and then some of the assessment functions. For example, one of the assessments that our staff perform is what's called a min choices assessment, and this can determine what type of home and community-based services a person would be eligible for. And at least in Cook County, our county human services staff are the ones who are trained to do those types of state-level assessments, where it's under the Department of Human Services. Okay. That may differ in larger communities, but
Great.
I can provide an update to both of your questions.
Yeah, that would be interesting to know, understand better. Thank you for your report. Thank you for all your work and the great recognition of doing a great job on your percentages. That's wonderful to hear. Are there any other questions or comments? All right. Thank you. We will move on to our items for board action, and the first one is the healthcare access policy that was referenced earlier. So, do you want to speak to one of you want to talk about that?
I think Allison gave a great overview in her
Yes.
presentation, just to reinforce that this is are taking a step towards expanding eligibility of this program where we're able to and still be within the Department of Human Services guidance for this program. All of the funds that we disperse in the community to eligible individuals, those are fully funded by the state. So these are state and federal dollars that are going out to help support people accessing out-of-area care, which we know is a major need. And planning as well alongside this to do some outreach to let people know that these types of meals are newly eligible for reimbursement.
Thank you for finding that and coming up with a solution, because, yeah, that just doesn't make sense in today's day and age to limit what is reimbursable, in my opinion, but, all right. Anybody? Yes, go ahead.
I was just going to make a motion to approve the updated Cook County Healthcare Access Policy.
Thank you. We have a motion. Do we have-
Svaleson supports.
Thank you, Commissioner Svaleson. We have motion, support. Any discussion?
Oh, can I just mention one
Yes.
thing? This would be effective January 1st of 2022. Yeah.
Okay.
And I'll amend the motion, I guess, just to clarify that. Thank you for that.
Okay.
Yep.
And I support.
Thank you. All right. All those in favor?
Aye.
Aye.
All right, motion passes. Thank you very much. And we'll move on to our public health grant funding. Thank you to the committee that had to do a lot of work on this. It must have been very difficult, and I appreciate the time and all the thought that went into helping figure this out. So, do you have any more comments, or Roger, do you want to speak to
I would invite Roger if he has anything to
How do
add.
we want to go into it? Do we want to wait until we have our debriefing meeting to make our recommendations, or should I give them an idea of what we're thinking about?
I included some of the recommendations in the written report, so some of the
Yep.
suggestions offered by the subcommittee around, how to, some of the general feedback on applications and some of our ideas for further improving the process as we attempt to do year after year, since this was delegated to PHHS and the Advisory Council in 2018.
I guess what I would say at this point is to just give you a little bit of thought, ahead of time about what we've been thinking. We had 224,000 requests for $137,000 funding. We had two new ones this time? And, which requires that we do some very creative looking at the requests, and obviously most people didn't get what they asked. What we would like to do is have the Public Health Board and the County Board look at this earlier in the year, earlier in the levying process, so that rather than coming out here at the end with X amount of dollars, we would make a part of the levy process where it would be figured in from the beginning rather than at the end. If we're going to continue to serve maybe more groups, if we continue to go up a couple every once in a while, it's going to mean there's going to be less money all around, and it would be better to be working earlier on the numbers than waiting until the end of the year. So that's just something we were thinking about, and I think that's probably our most important thing right now.
I think it was great that the committee is looking at ways of improving this process, and I appreciated the thought that went into the application process itself to make sure we're on a level playing field of what comes in and how you're judging projects and entities. And so I appreciate you guys doing a lot of work. I know it must not be easy, but thank you for that. And
Good
I...
group. Real good group. And it hurts to not be able to give people, when we see what they need, and there's a lot of need out there, and childcare especially, and related. I mean, because we're balancing the need for childcare versus the need for elder care, and it's hard to do. And when we only have 66 spots for 220 some kids, that's something that's got to be looked at. And not only by this board, but the county commissioners, by our advisory council, by the community as a whole. We need to start looking at it a little more seriously and supportively, because how can we expect to draw young families? You know, if we're taking care of the housing, that's one thing, but if there's no place to put the kids during the day when mom and dad are working, or if it's a single-parent family, then how are we going to keep them in the community? And we need youth. I mean, I know from experience, we're a very aging population, but we need someone else to come in and to be able to step in. So I think that's something we need. I don't know how we would look at it, but that's something I would recommend that we look at deeply.
Yeah, it's a big need, and as a grandmother, I know how much families rely on grandmothers, and we're not always available. We have to figure out something in our community. Lots of issues. And
Thank you, Madam Chair, and thank you for working on this, because I know it's not easy on your end. When you make these recommendations, it makes it much easier right now. So I really appreciate that, and I'm very, I maybe fully is an exaggeration, I recognize the need and the lack of funding here, but I am very accepting of the recommendation here, so thank you for that work, and I was just going to go ahead and make the motion to award the dollars as recommended.
thank you, Commissioner Mintz.
Svaleson supports.
And we have support.
I have a question.
Yes.
Am I allowed to vote on this, since I was on the committee that
Yes.
put it together? I am allowed?
Yep.
And I would like to add that we need to consider your request to get this into our levy budget earlier than what we're doing now in November.
Thank you.
Yeah, I think I also think that'd be really helpful for our process, and I don't anticipate new groups being added maybe as frequently, but we do need to be able to accommodate for when that happens, and also accommodate for when the needs are greater too, so.
And we don't want to penalize the ones that have been getting the funding for so long by not having enough to cover, and we don't want to penalize the new possibilities because we don't have them.
Yep.
And I also would like to make sure that we say those organizations still need to continue to try to seek other funding also, and
Absolutely.
make sure that it's not, don't just rely on us.
And that's a recommendation that we've made to these groups as well.
Yeah.
And that's something that we look at when we're funding, is are they going out and getting other?
Right.
You know, so, no, it can't be just this fund.
And I appreciated that in your report, that you were looking at that, so just. But, okay, any other questions, or if not, I'll call for the vote. All those in favor?
Aye.
All right, motion passes. Thank you very much.
Thank you.
And I assume you will let all these organizations know we pass this and they can expect their money. All right, we'll go on to our reports. Commissioner Svaleson.
No meeting this past month, no update.
Okay. Commissioner Mills.
With AUA, I'd probably just report that the challenges that we're experiencing are probably even greater for the rest of the region, as far as employee shortage and retention and just navigating COVID. And I guess I'm particularly speaking to the Head Start program that's through AOA. I think they're feeling that most acutely, and there's a lot of swings there, and that's, of course, impacting children there, and it's hitting our whole region, and I think EAOA sees a good amount of that too. So, but that's probably all I have to report there at this time. Moving on to the
Move on?
yeah, AHA, if I may. And a large part of that conversation was about the future funding for behavioral health in our region, and how, I think I've mentioned before, how the state is coming up with a new formula. There's a lot of concern about how that will impact us. Although we are not privy to the new formula yet, so we can't yet try to get a grasp of that or comment on it even, but we have been active in voicing our concerns there. Also, separately, the Moose Lake funds, which were set aside specifically for our region, are at this point, sounds like they will be dispersed statewide, and that's going to very acutely affect our region for funding. And so also trying to spearhead how we can get somebody's ear to get momentum there to kind of champion that at the state level. And there's a very strong group at AHA working on that exactly, but I'm hoping we can have more discussions with the tribes as well, because they will also be impacted, and they may have a more direct ear with the governor or at that state level. So just looking for all avenues there. And I think that's the bulk of it. There is a transition for the crisis line. It should be, we shouldn't feel a thing as far as that's concerned. If anything, an improvement is the hope there. So that's exciting, and also, you know, any transition makes people a little nervous, just, you know, not knowing how it's going to go. But I think it's very promising. I have more confidence than anxiety there, I guess. And that's all.
Thank you. ARC meeting is on Friday, so I don't have anything to report. ARDC.
We met last month, but nothing to report from that, and we're meeting this Thursday. However, I will say that in the future, I really don't see a need to have ARDC here on the health planning. It can be reported, you know, when we have our board meetings, because ARDC deals with business and planning and zones and parks, and they do have the aging council, and they do have some input with child care within our region. But basically, I think this could be removed in January, because I don't see any need to have it here in our health planning. So that's just an observation that I've had for the last 6 years.
I'm glad you're sharing that.
Okay.
Thank you. All right, back to you, Commissioner Mills.
Community Health Board. I don't think I have. You know, the one thing I do want to bring to everyone's attention is our community member Frankie Jarko will be moving from Cook County, and so we do need to find a replacement for her on the Community Health Board, but I don't have anything to report, I guess, beyond that.
I would just like to add on to that, we will miss her.
Yes.
She's contributed a lot to our community.
And she's been one who is willing to speak up and speak out at every community health board meeting. You know, she does kind of a state of what's going on in our community and gives people a good sense of kind of if there's a hot topic or whatever. So.
Now, she's still planning on remaining on the advisory council, so we will continue to have her support, and I'll wait till we do our little report.
Okay. This was what you were mentioning about trying to update the template. We still have Andrea's name on
Yeah.
the next one, so. Yeah, right. Templates, you can't fix them. So you want to report?
Okay. Well, we talked a lot about some of the same things as we've covered here with COVID and staffing. And one thing, just a sign of a sidelight, somebody brought up that the Hub Senior Center is seeing people, and Brother Stuff, seeing people with mental health, mental illness, evidence in their behavior. And I don't know if they were reaching out to find out what they should do, or calling somebody, or what, but.
They got some great resources from Allison
Okay.
and also from Sheriff Eliason.
Good.
And so it was really a great opportunity for them to get some information to help community members who are in need.
Good, because I know they have good relationships with a lot of people who do come in there a lot.
Right.
And spend time, so, good. Let's see. We had, Carly Puck thanked people for the mindfulness opportunity at the school and the yoga classes that the children have been very appreciative of, and she feels like it's really helping people to do that, and was maybe going to even try to expand it a little bit. And Sarah gave a report on suicide prevention, that they're working on that, which is, of course, very important. And I think that's about it for the highlights. Anything else you think?
I was just looking back at my notes and I can't find them. That was, I think you
Yeah.
Thank you very much.
Okay.
Let's see, Restorative Justice, we're meeting tomorrow, so I don't really have anything to report on that. Council on Aging.
So in addition to what Rana shared with all of you, they have been continuing, as you know, to work on their bylaws and new applications. They're just updating and revising, and they have currently a Facebook page, but they don't have a website, and they're thinking about moving into the 21st century and developing a website. So we finalized a social media policy for the Cook County Council on Aging. So that was really an exciting process to go through and talk about what are the needs for that type of policy for an organization. So they are continuing to move ahead.
All right. It's good to hear. Thank you. Emergency Preparedness Committee.
Well, largely just COVID talk, as you can imagine. I don't think I have anything to add, really. We've got a very thorough report from Grace, and of course, that's more updated than what we talked about then. So that's probably worth noting, just how much it's changing even now.
Yes.
So.
Okay. Commissioner Storlie, back to you.
Thank you. Healthcare planning will meet in December. We're going every other month, but I really hope we can continue to do every month. There's just so much going on in the community that I think we all need to kind of understand. As I, asked Grace this morning, how does all this work together? So hopefully I'll have a December report. I'll go on to NACO. I attended a webinar only because the topic was so interesting. It was the indigent community and health. And I just listened. They're forming a subcommittee. I'm not going to be on it. But just interesting from around the country. And we talked about, there are poor people in every community, as we just found out this morning. In some areas around the country, it includes the homelessness, it includes people evicted from their homes, all kinds of adjectives that you could place on the indigent community. And just interesting to hear from other parts of the country for an hour. And it was quite eye-opening about what is taking place. I think it would be better to say in larger communities. It's a huge problem, of course, but in our community, we still, as we heard this morning, we're trying to help people and trying to work with the government and state and federal regulations and how all that plays out and how we serve that community. So it was interesting, to say the least.
Thank you. Commissioner Mills, do you have anything to report from?
No, just, I guess, and this is, we did not meet, but we received resignation from the previous director, who had left her position to take this partnership with the schools in the region on the range, to try to do more of a job training in the school, and so that was Michelle, and so she now resigned from that position, and it's not entirely clear how that's going to change the workings there, just because that was kind of a new program anyways, but it's significant in my mind, just because she was such an asset to that organization. But otherwise, no, we didn't meet, so nothing to report there.
So another resignation.
Yep,
Oh.
yep.
Okay, and we'll, North Shore, sorry.
Yep, yeah, North Shore Collaborative, we did meet, and we awarded grants, and we still had money left over, and this is, put the word out to areas in the community, and I think it's applicable to the grants we couldn't fulfill through our county grant program. So those dollars will roll over into the next year. So we didn't lose that, but it's just sitting there and just needs that process. And it's a quarterly evaluation. So even if it's not this next meeting, it could be in the following one. So there's more opportunities there. But yep, that's all.
So maybe when you let these people know about the awards, we say, make sure you apply to these other places also. That'd be good.
Yeah, on that note, I also had heard that the Loika Johnson is welcoming more and higher volume of applications. So please put the word out there. I think in general our community is aware of that, but just hearing that made me want to share it with everyone. So,
all right, on to you, Roger.
Thank you, Madam Chair, and you've all have my report. The report on the Wilder research and everything that we had was very interesting. And are they coming in December?
Yes, they will.
So you will get to hear the same report, and I think you'll find it extremely interesting. And maybe that'll give us some ideas of where we can go from here, as we've been talking earlier. It's nice, changing the topic a little bit, it's nice that we're going to be welcoming 3 of our emeritus members back on as full-time members next in January. And that will be Carla LaPointe and Jerry Lilja and Frankie Jarchow will be coming back as full-fledged members, even though Carla and Frankie are not living here right now. They are staying on the committee, on the council, which is good because we benefit from their expertise and their wisdom. And if you know of anybody who is interested in serving, young or old, let Allison know, please, so that we would love to continue to expand the size of the committee. It's a good bunch. I think that's all I've got, unless there's anything else that you can think of. So that's what I've got.
All right, thank you very much.
You're welcome.
One thing for the good of the order here, as I attended my first Duluth area YMCA meeting, and that was a very informative meeting and very exciting. Much different dynamic from our local advisory council, and that's actually where the rubber hits the road as far as making decisions. Is our advisory council gives recommendations and whatnot to the Duluth area YMCA board, and so that was a good, I think, step for our community to have representation on there again. Myron Bersheim was representing our community on there, and then his term expired, and I think kind of ran a little long even. And so then I was approved onto that, so.
Just point, to clarify for me, do you get to vote at
Yes.
that level?
Yes.
You get to vote.
Yep. So I thought it was really important, and we had discussions just about how that might work and potential conflicts, as we are the landlord of the building. But former Commissioner Berscheim then had similar navigational kind of challenges, but it sounded like it was always able to work out there. So I'm excited to be engaged at that level, just to be able to have that voice at the table for our community.
Sorry, I have to write things down while I think of it, so I don't forget to think about that later. All right. Anybody else have anything else to share? All right, well, we've got a couple minutes over.
I have just one more comment to some of the discussion around homelessness as an issue in our community and how this looks very different than it does in more urban communities. Just want to recognize our staff in human services, especially in intake, who are doing a great deal of work to connect people who are in housing crisis with resources, either available through our economic assistance programs, other community or regional resources. It is something that happens here in Cook County. It's not visible, it's not seen, and it is something that people experience on a regular basis, and our staff are really doing fantastic work in advocating for people and supporting them in trying times. As you heard from Allison this morning, we're anticipating an increase in Medicare premiums. We're also starting to hear about the increases in utility expenses that are projected for this winter, and knowing that that will have ripple effects on the people we serve, on all of us. But just something that we're gearing up for in terms of connecting people with resources to support them in their housing, or connecting them with housing in the community or outside of it.
Thank you for sharing.
Does someone have a more positive note we can end on?
Pardon me?
Does someone have a more positive note?
Anybody else have anything they want to share to that? No?
Did I mention that I'm on the Duluth area Alliance?
Okay. So the next item on our agenda is adjournment. Do we have a motion?
Madam Chair, I'll motion to adjourn.
Thank you. Do we have a second?
Support.
Thank you. All those in favor?
Aye.
Opposed? All right. Thank you very much.
Thank you.
Sorry to bring up.
No, it is. I mean, it's something that is
Interesting, David, we'll just go home.
often unseen, but it's something that our staff see.
Everybody does that here, basically.
It's kind of other favor. We still see it in some of our policies, like fair
So we get a break for how long?
Well,
Do you have a
Just
second?
at least to make a run down the hall?
yes.
Okay, good.
I'll sit tight and, thank you, Roger. Have a good day.
You as well.
Thank you.